Know your risk for infection. When you have cancer, many changes can happen to your body. These changes may include your body not being able to stop or fight infection as well as it could before you had cancer. It is important to take steps to help prevent infection. Staying free of infection helps you feel your best and prevents unwanted pauses in your cancer treatment. For example, your doctor may delay your cancer treatments during a time of fever or illness. Another reason to be aware of your infection risk is that, in some cases, an infection can develop into a serious health condition known as sepsis. Sepsis usually requires a stay in the hospital and can become life-threatening. To help you stay as safe as possible, it is important to know the signs of infection and when to call the doctor. An infection is the growth of germs in your body. Germs can include bacteria, viruses, yeast, fungi, or even parasites. It is the job of your body's immune system to protect from or get rid of infection. Your immune system is made of many parts, including your white blood cells. Your healthcare team will carefully watch your white blood cell count by taking regular blood tests throughout your cancer care. Your doctor may order a white blood cell count differential. A differential provides information about the types of white blood cells in your blood. This is important because each type of white blood cell has a different job to help your body fight infection. There are 5 types of white blood cells. They are basophils, eosinophils, lymphocytes, monocytes, and neutrophils. A neutrophil is the type of white blood cell you may hear about the most. The number of neutrophils you have in a certain amount of blood is listed on your blood test report as an absolute neutrophil count, or ANC. Your ANC results may be found on your complete blood count, or CBC, report. Ask your healthcare team to help you find your ANC results on the report and explain what these results mean for your care. The lower your ANC number drops and the longer it stays low, the higher your risk of an infection. Based on how low the neutrophil count is, your doctor may say you are neutropenic and order medicine to help your body make more white blood cells to fight infection. If your ANC gets very low, you may not have the typical signs of infection, such as pus, pain, swelling, or redness. This can make it hard to know if you have an infection. However, always check your temperature if you're not feeling well. A fever may be the only sign that you have an infection. Call your doctor right away to report your concerns. For most people with cancer, the high-risk time for getting an infection lasts for short periods. The length of this high-risk time is based on the type of cancer you have, the cancer treatment you are given, and how long it has been since you started or stopped receiving your treatment. Based on your blood test results, your healthcare team will tell you if you are in one of these high-risk periods. There are different reasons why having cancer can increase your infection risk. For example, your risk of infection may be higher due to the stress of having cancer, or changes in your ability to eat or drink as healthy as you did in the past. You may be more at risk of infection if you are older, weak, or frail. Not getting enough sleep can also weaken your immune system. The type of cancer and the amount of cancer you have in your body affect your risk of infection. For example, leukemia or lymphoma may cause changes to your immune system and increase your risk of infection. Or, a cancerous growth may increase your risk of infection if it blocks or lowers blood flow to a part of your body. It may also cause a break in your skin, which allows germs to enter. If cancer grows, it may cause your body tissue or organs not to work as they should. Any body tissue that is damaged is at a higher risk of infection. In other cases, the cancer treatment may cause your immune system to become weaker and not able to fight infection. Examples of some of these treatments include surgery, chemotherapy, immunotherapy, radiation therapy, stem cell or bone marrow transplant, or steroids. If your cancer treatment includes surgery or a medical procedure that causes you to have an incision, puncture, or break in the skin, germs can enter your body. If you have a catheter or tube placed in your body, it can also increase your infection risk. Medicine that is given to help you sleep during surgery, called anesthesia, may limit your ability to take deep breaths and lead to chest congestion or even pneumonia. The risk of infection with surgery increases with longer hospital stays, longer time spent in surgery, larger amounts of blood loss, or any health problems you had before or have right after surgery, such as diabetes or a heart condition. If your cancer treatment includes chemotherapy, your immune system may become weakened. This side effect may depend on the type of chemotherapy drugs used in your care and the chemotherapy dose or how much chemotherapy you take and how often it is given. Chemotherapy works by killing both the bad and the good, fast-growing cells in your body. This means that along with getting rid of the fast-growing cancer cells, chemotherapy may also get rid of your fast-growing, infection-fighting white blood cells. Immunotherapy is another cancer treatment used to improve your immune system's ability to find and attack cancer cells. However, it may also weaken your immune system's ability to fight off infections. Radiation therapy can also cause your immune system to weaken. However, in most cases, radiation is given to only one part of the body, so it does not do much damage to the immune system. Radiation's impact on your infection risk is based on your radiation dose, the amount of radiation, and how many treatments you receive, the part of your body being treated with radiation, and how much area of your body is being treated. Total body irradiation can lead to very low white blood cell counts and a high infection risk. This type of radiation is often used when getting ready for a bone marrow or stem cell transplant. For those treated with total body irradiation, their high-risk time for infection can last much longer than with other types of cancer treatment. If you have cancer, it is important to find and treat infections early when they are easier to treat. It is important for you to know the signs of infection. However, the signs may be different based on where the infection is located in your body. Some of the normal signs of infection may not be present if your neutrophil count, or ANC, is very low. Tell your doctor if you have a fever of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher. It is important to have a thermometer close by so you can check for a fever regularly, especially during times when you are not feeling well. Be sure to ask a member of your healthcare team before taking over-the-counter medicine, such as aspirin, acetaminophen, or ibuprofen for a fever. These medicines can lower a fever, but hide the signs of a more serious infection. Let your doctor know if you have chills, shivering, or feel very cold, clammy, or sweaty skin. Tell your doctor about a new cough, or if you feel short of breath, weak, or lightheaded. Infections may cause a sore throat, headache, ear pain, nasal congestion, or sinus pain. With an infection, you may see a skin rash, sores, or white coating on your tongue or mouth. There may be swelling, redness, drainage, or warmth near where a catheter enters your body, or in the location where your surgery was done. Tell your doctor if your urine looks bloody, cloudy, or if you have pain when you urinate. You should also call if you have extreme pain or discomfort, including pain in the stomach or belly area, or a stiff neck. Let them know about any times when you feel confused or cannot think clearly. When you are at a higher risk of infection, you may also be at a higher risk for sepsis. Sepsis is a serious condition that involves a widespread infection in your body. It often starts with an infection, such as an open sore or break in your skin, pneumonia, the flu, or a urinary tract infection. Bacteria usually causes this type of infection, but it can also be from a fungus or virus. Sepsis is caused by your body's response to an infection. For some, that includes a dangerously low blood pressure. A very low blood pressure can cause less blood flow to your body's organs, making it hard for them to work properly. This is called septic shock. Symptoms of septic shock can include the same symptoms we just talked about, plus you may feel restless, have a rapid heart rate, or fast breathing. You may find that you are not peeing as much as usual or not peeing at all. Some people who have sepsis also feel nauseated, vomit, or have diarrhea. If sepsis gets worse, it can lead to long-term tissue damage, organ failure, and even death. It is important for you to report any signs of sepsis quickly. Call 911 and tell the emergency room staff when you arrive that you are concerned you may have sepsis. We hope this information has helped you to better understand your possible risk for infection and sepsis when you have cancer. If you would like more information on how to avoid infection, watch the James Patient Education video, Patient Safety Series, Ways to Prevent Infection. Write down any questions you might have for your healthcare team and bring them with you to each appointment. We are honored to care for you during your cancer treatment. Thank you for choosing the James.